Hello, everyone, and welcome back to class. So, each of you should have received by now feedback on ARP2, on that ARP2 rough draft assignment. If you have not, please email me ASAP because I probably reviewed it, but maybe forgot to send it via email. So, based upon the reviews, I want to make some slight changes to the class schedule. So first off, this week we were going to be looking at creating your poster. I flipped this week and next week. So I want to give feedback this week because there's some things we need to be doing to revise the manuscript. And I also want to highlight some goals for keeping you moving with your revisions. So see week 5 there. Now, originally, I had just written check in with your dissertation committee, so now I want to give you something purposeful to do. This should be when your next draft goes to your committee. Now, of course, at any time you can have discussions with your committee, and I'm going to also do a separate recording for them, talking to them about the timelines and what their roles are. But let's get a next draft to your committee by then with the goal for the committee to turn around revisions in 2 weeks. Then October 28th, the next draft to your committee and to me. So again, I'm serving a role as an outside reviewer, somebody that doesn't necessarily know the content and is looking for overall flow, making sure all of the particular sections are necessarily there for the systematic reviews and the scoping reviews. And again, the goal will be for the committee to turn things around in 2 weeks to get back to you at that point. Then I'd like for you to submit to your committee chair by December 9th for the final checkoff. That's for your paper to submit by the final checkoff for December 9th. That way your committee chair can let me know, and then you can submit your final paper to me by December 13th. Okay, so again, all the rough drafts have been returned. So now let's talk about formatting. So some of the formats that came in were correct, and some of them were deviated a little bit. And so I tried to highlight that to you. And so if we go back to last term in week 4, there is the systematic review or scoping review fact sheet. And I'm going to upload that again into this week's module of ARP3. These should be the components of your manuscript, regardless of whether you're doing a systematic review or a scoping review. There should be an introduction section, not a background section. So some people had introduction and background, only introduction. There should be a methods section, which has your search strategy and a table. And let's also include that Prisma figure. The results section should have a table or tables summarizing the evidence, as well as text, a discussion section, and a conclusion section. So your introduction section, general feedback here should be 3 to 5 paragraphs. Some were a little bit long. And if we're looking at a 3 to 5 paragraph or specifically a 3-paragraph approach, paragraph 1 introduces you to the topic and the problem. Paragraph 2, what is currently known. Paragraph 3, the purpose of this paper. So, for example, if I was doing a systematic review on diet and cardiovascular disease, the introduction section might talk about cardiovascular disease, present rates, talk about it being a primary killer in the United States, and that cardiovascular disease, a potential risk factor, is a diet high in ultra-processed foods, saturated fats, and high in sugars. In paragraph number 2, talk about current dietary recommendations for patients with cardiovascular disease. So this was where you might go into talking about things like the Mediterranean diet, talking about the DASH diet, maybe the Ornish diet, maybe a vegetarian diet, and then tie things up in a 3rd paragraph with the purpose of this systematic review or scoping review to identify the reduction of subsequent cardiovascular disease events in those who adopt a DASH diet. Now, you may need another paragraph or two to fully flush out your introduction, and that's perfectly fine. Avoid the temptation of having extra stuff in there, and I tried to highlight that for some of you. Some of the things are more appropriate to go into the discussion section. So again, delete the background sections. Any content in a background section should either be incorporated into the intro or moved to the discussion if you and your committee deem it to be appropriate. Methods section. Some of these got a little bit long, and I can appreciate that. You want to have more information, making sure you've got everything in there. They can be extremely short. This is an example from one of my papers. Now, this one was published in Sports Health, and that journal is notorious for editing, so it's very possible that I had more written there and they just edited the daylights out of it. But they can be quite short. Here's an example from a scoping review. That was an example from last term, so a little bit longer. And it is, again, appropriate to include your search strategy, the eligibility or inclusion-exclusion criteria, and in this section, we do want to have a table illustrating our keyword and keyword combinations that we used and the number of articles found, as well as the Prisma figure. For some of you, I included this text, and this is very appropriate to cut and paste if you want. Table 1 presents the keyword or keyword combinations utilized in the search strategy for this systematic review. If fewer than, and then you name the number of articles like 200 or 300. If fewer than 200 articles were identified by a search strategy, the study abstracts were reviewed from that category in order to identify potentially relevant papers. The reference list of each of the selected papers was also reviewed in order to identify additional relevant publications. So this is something that we want to have within the methods section. So for those that didn't have that, please include that now. Also, your tables in your rough drafts that you send us, as well as any manuscripts that you submit for journal consideration, your rough drafts, your tables need to be editable. So some of them are, I'm not sure how you would describe it, kind of, well, they aren't, I wasn't able to make edits on them directly. So you need to be able to make edits on those. And then looking back, your table number and title should be at the top of the table, and at the bottom should be any information in case you have like abbreviations. Spell out those abbreviations at that point, but the table number and title at the top, please. And then figure. This is the figure, the Prisma figure, and it looked like most of you had that in there. If you did not, that should also be included. Now your results section. So what text to include, and you need to have a table or tables. So those are the big kind of things to think about here. What text to include? So some of you nailed it. Some of you had some nice alternate things, and some were a little bit long. This is going to be where you and the committee will need to discuss editing, but when possible, try to, especially if doing a scoping review, try to summarize things in relation to a particular topic. So for example, here is a summarization. 3 studies reported decreased rates of subsequent cardiovascular events in adults 65 years and older who adopted the DASH diet. And then table X would then direct somebody to see the full set of details. And then, of course, I don't want to have citations there. And then I could go on to briefly describe each of those 3 studies. Smith et al. Reported a 2-year adherence, blah, blah, blah. Williams et al., blah, blah, blah. Miller et al., blah, blah, blah. Other strategies, if you have a limited number of papers, then is to describe each study in one paragraph. And that might be especially appropriate in situations where you have a variety of study methodologies. Maybe you've got a randomized control trial, maybe there's a case report, maybe there's a cohort study. They're all over the board where it's hard to summarize things. Now, in this results section, you don't want to present all the details because your table should include a lot of that information. So this came from an example in class earlier in the year. And what you can see here with looking at one of these GLP-1 drugs, you might be able to combine all those and say something to the effect that 4 studies utilized a dose of 2.4 milligrams and compared outcomes against a group that received a placebo. And then you could go on to describe then each of these 4 studies had a study duration of approximately 68 weeks and consisted of adults with a mean age range of 46 to 51 years. Now, this table doesn't list outcomes, but if it had, then you could summarize, and the outcomes were those in the experimental group experienced X, Y, and Z, whereas those in the control group did not. Discussion section is where you're going to put the findings in context. And this is where, especially in those papers that have a lot of variety, where you need to spend some time kind of pulling it all together and putting it in context so that the reader understands what the findings are and what they mean in the big picture. Understanding what the strengths of those studies are, and then the associated weaknesses and limitations of the current research. And then finally, the conclusion section, you want to wrap things up in one paragraph. Some were a little bit long. So based on the evidence, what should a medical provider do? For example, if you are looking at something that maybe there isn't randomized controlled trials available, but the item is very low risk or no risk, you might be able to conservatively say something like the use of treatment X provides the potential to reduce X, Y, and Z in patients with condition Z. Currently, there are a lack of randomized controlled trials comparing the efficacy of this treatment versus other standard treatments, period. However, this treatment poses very little or no risk and is an inexpensive therapeutic. All right, so also want to highlight that some of the final papers that I got back to people, they looked good. There may not have been a lot of comments. I was also doing those near the end of my overall editing, and so there may be grammar things that my eyes were just kind of too tired to see. So if you didn't have a lot of comments come back to yours, well, it could mean one of two things. It could mean it was really, really great, or it could mean I was getting kind of tired. And stay tuned that maybe your committee or I will find more stuff in the future. But I do want to say to everybody, good work. Keep up the good work. I know how difficult it is to try to master your clinical experiences, your clinical internships here. and feel like you're doing a great job with that because you're going out to prepare yourselves to work with people very, very soon and be independent practitioners. And at the same time, trying to do something significant with this assignment. Keep it up.